Asthma. So asthma is caused by an allergic reaction in the lungs to substances such as dust, traffic fumes, animal hair. Essentially, it's an autoimmune response. The normal bronchial are clear, and then what happens when this allergic reaction, as it were, starts to kick in, there's a spasm in the airway. You get swelling. There's a build-up of mucus, which is very difficult to clear. What you're looking for is signs and symptoms such as difficulty in breathing. They're very wheezy. They have difficulty in speaking because obviously communication is low priority compared to getting oxygen into your body. The skin is very pale and clammy, and they can show signs of what we call cyanosis. When there's not enough oxygen actually in the blood, the skin starts to take the appearance of being quite grey, and the lips are one of the earliest ones to go. The breathing movements will be laboured as they become quite anxious. So in the worst case scenario, we could be looking at unconsciousness, and if that happens, it goes back to your primary assessment, which is, what's the level of consciousness? Do they have an open and clear airway, and are they breathing? So how do we treat them? It's really important not to lay a person down who's suffering from asthma. They want to sit upright to help them breathe correctly. Easy to say, but when someone's feeling very concerned about their breathing, a panic can set in to make the situation worse. So we always try and keep them as calm as possible just by using some good, steady language. If they have got their own medication with them, which is a reliever, the blue ones, then yeah, absolutely find that inhaler and make sure that they self-administer. It's not recommended to give someone somebody else's medication, so they should have their own with them. If the situation doesn't improve, or you're concerned about their colour, if they've got prolonged blue lips, things like that, you may consider it's time to activate the emergency services. But again, communicate with them. They'll give you a guide if they are feeling the need to get additional help. Obviously, as soon as that person can't communicate with you in a meaningful way, it's 999 anyway, because they can't tell you what's really going on. Avoid hot to cold. That's typically what can cause a spasm. If you're in a very warm air-conditioned room, or you walk into an air-conditioned room, or you walk into an environment which has been a sudden change in temperature, that can cause a problem as well. And just finally, just to reiterate about the upright position, try and keep the casualty upright as best as possible. So we're going to go on to wounds, bleeding. So essentially what we need to think about is how we're going to deal with that person who suddenly realises that they've cut themselves or they've damaged themselves. We all feel unwell when we suddenly see some red blood, and it's quite normal for either the person who witnesses it or for the actual patient to feel really unwell and nauseous. So the thing is to sit them down, put less strain on their system. The blood's got less work to do, the heart's not pumping as hard. So just try and get them down. Ideally, I would actually sit them on the floor if possible, because if they do become faint, they've got less distance to fall. If you sit them on a chair, if it's a serious injury, you might get problems. If it's a leg injury, they've got to sit down anyway. Check to see exactly what's going on before you start putting a dressing on, just quickly. If they've got something in there, glass or something broken in there, you don't want to suddenly whack a dressing on. So quick inspection to make sure it's safe to put a dressing on. Lift the leg or the arm. That will allow gravity to do its job, and apply pressure. I mean, the human body's amazing. The actual mechanism, when the body realises there's blood leaving and contacts with air, it will start to coagulate, it will start to congeal, and also the arteries and veins actually close off to reduce the blood leaving the body. It's very, very clever in what it does. We're just helping by elevating and applying the pressure. There's actually different sorts of wounds. A contusion is essentially a bruise through a blunt injury, a blunt force trauma, a crushing injury, something like that. An abrasion is quite common with children for knees and elbows. That's basically friction that's torn away the skin from falling on something hard. A laceration would be created by a tearing, a dragging on something, such as, say, broken glass or barbed wire or something like that. Incision, a sharp instrument, would be a knife or a blade, and a puncture would be created by a nail or something like that. Finally, of course, you could get a gunshot. Thankfully, in this country, it's not as common, but it does happen. And just be aware that, should, heaven forbid, anybody gets shot, is to ensure that you identify where the site of the injury is, because gunshot wounds do normally carry a wound that goes in, which is smaller, and a wound that leaves the body if that happens, and that's normally an exit wound, which can be significantly bigger. So just bear in mind to have a look for that. Dressings. Treatment is pretty much the same unless you've got a foreign object or a bone protruding. But dressing practice will happen on the day of your practical session. You'll get a demonstration and you get to go off into your little groups and do a bit of bandaging, see how good your bandaging skills are. But really, that pressure and raising the wound will start to affect the blood loss quite quickly. If you've got a nosebleed, we used to talk about holding the head back to stop the blood coming out. We don't want that to happen. We want the blood to flow freely out of the body so it doesn't cause any problems, but we do want to stop the bleed. So what we would do is we'd lead them forward initially, because the priority is to keep the airway open, and then you would pinch the soft part of the nose as high as possible to try and stem the flow. Again, you're applying pressure, if you like, on the wound area to try and reduce the blood loss. You keep that pressure on, or have the patient put the pressure on for 10 minutes, and then you would release to see if the natural clotting process had taken place. It hopefully will have sorted itself out, but sometimes, for whatever reason, if the patient's blood's quite thin, or if for example, they've got a history of nosebleeds, it may continue. So we'd reapply again and see what's going on at that point. Really, after 20 minutes, if the blood's still coming out significantly, you should consider transportation to the emergency services, transportation to the hospital, depending on the severity, whether you would self-transport or activate the emergency services.